Number 13, this might need to be number 1, self-care. If you do not take care of yourself first, you will not be able to take care of others. And that includes your patients. That's first and foremost your patients, but it might also be some family members. And there are usually 4 aspects to this. So first of all, nutrition. Make sure that you eat well. You need to fuel your brain so that you can use it and it can help you retain the information and apply it in school and in clinical. I usually recommend having small frequent meals or snacks available. If you know you're going to be at the hospital for 12 hours, don't just bring one big meal. Make sure you bring a water bottle so you can stay hydrated, and bring 1 or 2 meals and several snacks that are preferably easily accessible that you can snack on while you're taking care of your patients. And good meals typically consist of a good combination of healthy carbohydrates, proteins, and fats. My favorite example before the exam, breakfast burrito, whole wheat tortilla, healthy carbohydrates and fiber. Maybe you put an egg in there for your protein, and then you add some avocado and you have your healthy fat. It'll fuel you, it'll last you because of the protein and the fat content, and you'll be golden through the exam. Exercise and fresh air. A lot of times I hear from students, I don't have the time to exercise. Well, if you plan your day out right, you can make time to exercise. And it doesn't take much. All it takes is getting up, walking around the block, running up and down the stairs, doing some stretches, finding a quick workout video, whatever it is. You don't have to spend 2 hours. Find a video so that you don't have to drive anywhere. Go outside in your courtyard, in your yard, do some sort of physical activity every single day. Particularly if you're sitting there and studying for a prolonged period of time, because you will get tired. Then you move around, you feel refreshed after you've just been outside, and now you can get back to your studies. Sleep is super important. Everybody has different needs for sleep, and typically that's anywhere between 6 to 9 hours. Now, if you are up studying or finishing your care plan till 2:30 in the morning, but you have to be a clinical at 6 in the morning, you probably won't be getting much out of clinical. You'll be tired, you'll be irritable, you won't be retaining information, and you won't serve your patient the right way. You won't learn much. So make sure that you get enough sleep. Now, for students with children and other obligations, it might be a little bit more difficult. So talk to your partner, your significant other, your family, whoever is helping you, so that you can get the sleep that you need, because also when we sleep, our brain makes these connections, the synapses connect. So now you've learned the information in physiology, you've read about it in your book, you've applied it with your study group, you had a case study in lecture. While you sleep, it's all coming together. So you're making those connections while you're just dreaming about whatever it is that you're dreaming about. And then spend time with people you care about. This is super important. We are social beings. So if you have children, set some time aside a day, maybe an hour, half an hour, whatever it is that you can dedicate, but spend some time with them. If you just isolate yourself in your room, lock yourself up, you're not going to be very happy. Your family is not going to be very happy with you. Make some time to socialize. Super, super important. But again, plan it out well so that you say, okay, I've now been at this birthday party for a couple of hours. It's time for me to go home and get back to my studies. But these 4 under self-care here are very important and might be the most important things. And this will serve you well, not only during nursing school, but also while you're working as a nurse. Because nursing is a stressful job sometimes, but if you perform the self-care, you will always serve your patients right.